targeted therapy possible after a first-gen TKI that acquired resistance after first-gen TKI that was not T790M? Formally, if a patient's gotten first or second-gen TKI and they progress without T790M, osimertinib doesn't have a formal indication. If you go back to the phase 1 data, it actually does occasionally work in those contexts. It's a more potent TKI. The other thing to say about is that there is a literature on TKI past progression. So that, for example, in patients with slow progression on TKI, you can just keep going if it's helping from a human standpoint. There's something of a literature on coming back to TKI after time has passed, that it can sometimes help. And so, for insurance purposes, you wouldn't phrase this as that you were moving from first to third gen TKI in the absence of T790M. You would phrase it as retreatment. And there are human goals to doing that beyond whatever the panelists might think about osimertinib in T790M negative resistance, which is that it's also less toxic than the first or second generation TKI. So I think this, for most insurance, this is something that would be allowed as an option. Whether it's right for you individually is a conversation to have with your doctor. Is it one of the things that we consider in our therapeutic quiver to return back to TKI at some later point? This very much is something discussed in clinical practice. I'm intentionally pausing in case either of my panelists have anything to add to that.
No, I think that since this has been a talk on liquid biopsy versus tissue biopsy, and to answer that T790M negative question, a situation where we saw that, a biopsy may show T790M, but someone may benefit from osimertinib, is that when they started initially doing liquid biopsies and comparing to tissue biopsies, you were picking up some of these relevant things like T790M more in liquid than tissue, because liquid is more comprehensive. So maybe T790M was present at other sites that you didn't biopsy. And so I think that that is an advantage of looking to moving or steering towards liquid biopsy as well.